My name is Debbie Polshuk. I was a school speech pathologist and reading specialist for 34 years with the New York City Department of Education. I've lived in West Brighton for 42 years. I worked at many schools on the North Shore, PS 57, PS 31, PS 16, and PS 18. I served as a UFT chapter leader. My son-in-law is a math teacher at Port Richmond High School. My children went to schools on Staten Island, and my grandsons attend school on Staten Island now. The idea for this forum first came to me after I read the Citizens Committee for Children of New York's report on the North Shore of Staten Island. I wanted to share the information that I had read with residents of Staten Island who wanted to organize and demand specific changes from the politicians and our institutions, including universal health care, affordable housing, and equitable education. COVID-19 was a cataclysmic happening in the US. Over 500,000 people died, a number that is greater than the population of Staten Island. A shining light during this dark time was the outpouring of multiracial demonstrators to protest the racist murder of George Floyd and Breonna Taylor. Next year, as institutions reopen, residents on the North Shore will still try to change the glaring inequality that exists between the very rich and Black and Latinx workers that we are discussing in this forum today. So I'm going to turn this over now to Bijan, who, oops, sorry. I got a page down. Okay. All right. Our first speaker is Bijan Kimiagar. I hope I said it right, Ph.D. He is the Associate Executive Director for Research of the Citizens Committee for Children. He and his colleagues did in-depth research and wrote a detailed report titled The North Shore of Staten Island, Community-Driven Solutions to Improve Child and Family Well-Being. Data-driven research was used to formulate specific suggested changes for the welfare of North Shore families. Bijan has conducted research in New York City as well as throughout the world. He holds a Ph.D. in environmental psychology from the CUNY Graduate Center. Bijan?
Thank you, Debbie. And thank you to Peace Action Staten Island and for everyone who's on the call today. I'm just going to take a second to share my screen and make sure that it's working. So I have some slides to share. Let's see. Hopefully you all can see this clearly. If you can, just give me a thumbs up. Great. Okay. As I'm going through, please feel free to interrupt me. And also, Debbie, if you need to cut me off at any point to move on to the next thing, please do.
I just, actually, as long as you're saying this, we will have time for, hopefully we will have time for questions and comments at the end of the presentations. So please, people are welcome to put their comments and questions in the chat, and we will manage that after the presentations.
Okay. So I want to say thank you, Debbie, for having me, for reading this report. I was saying earlier that it's really meaningful when folks find a document that we produced useful. We released it in 2018, and I still find it really useful. And what I'm trying to do today is to leverage the information in there and share some new information too about families on the North Shore and things that we can be keeping in mind. I'm really grateful to have Adrienne Abatte, Kelly Villar, and Sarah Bloss on the presentations today too, because you all are critical to the well-being of North Shore children and families. And I've really relied on both of your organizations throughout the project, and still do today in terms of keeping in touch. You all have your finger on the pulse of what's happening. So I feel really honored to be presenting alongside all of you. What I'll be sharing today is a little bit about Citizens Committee for Children, for those of you who are learning about us, our data resources, why we produce them. I'll share why and how we went about our community-based assessment in the North Shore in partnership with Adrienne's group, Kelly's group, and many others. as well as families that they work with and that other organizations work with. I'll share key data points from our report, as well as more recent information. I'm going to focus on economic and housing security and some educational outcomes, and really dive into some transportation issues that we heard during the project. There's more that I could probably share on health issues or other topics that I think either the co-presenters or another time we might be able to dive into. And then I wanted to, based on what Debbie said to me before today, like, how can we take action on some of this information? How can we use this information to actually make a meaningful change for families in the North Shore, borough-wide and also citywide? And so I'm going to be sharing some ways that we might do that. So a little bit about Citizens Committee for Children. We're a nonprofit, nonpartisan organization. We have been around since the 1940s, and since that time have really been focused on ensuring that every child is healthy, housed, educated, and safe. We do this through a combination of policy advocacy, budgetary advocacy at both the city and the state level. We do it through public education programs and civic engagement. We do it through data analysis and research, making sure that all of our policy work and our public education programs are grounded in data and understandings of both the worrisome and welcome trends and conditions that are facing New York City's children and families. I'll be sharing with you several of the data resources today. There's a lot more that I'd like to, but I just want to give an overview to say that we produce a lot of in-print and digital publications. One of the main publications we put out every other year is the Keeping Track of New York City's Children data book. It's a compendium of information across multiple domains of child and family well-being. We, alongside this every year, put out what we call our Child and Family Wellbeing Index, which takes 18 indicators of well-being, things like, what is the share of children living in households with in poverty? What is the share of children who are enrolled in early education programs? Take 18 of these key indicators that we monitor over time and kind of summarize where are the community districts in New York City where families are facing multiple barriers to their well-being, because we know that taking this holistic approach, when families face, one type of challenge, hopefully they can address it easily. But when families are facing multiple economic or housing security challenges, educational challenges, all of these things become multiple stressors that compound and have detrimental impacts on child and family well-being. So we use this as a kind of broad stroke tool to really focus in on where in the city there needs to be additional investments. And this broad stroke approach is complemented by a really focused and granular view through our community-based assessments, one of which we did in the North Shore in 2008, and others we've done in the Northern Manhattan area, most recently in Elmhurst, Corona, Queens, and then also in Brownsville, Brooklyn. We've also done more focused work geographically in other parts of the city. We just haven't necessarily codified it in a summative report as we did for the North Shore. And when I'm talking about the North Shore, it's really these community district boundaries that you see on the map on the right-hand side for New York City. There are 59 of them. They mirror more or less the community board boundaries. All of the information, I would say, well, actually, most of the information I'll be sharing today is available on our database, data.cccneyork.org. I encourage you to take a look after today. We have hundreds of indicators that might be of interest to you. Information from the Wellbeing Index is posted there. We also have information on community resources, things like libraries. I actually set my background today for the Stapleton Library because it was a place that I found as a resource when I was doing this project on the North Shore. And you can download the data and share the data with others, either as raw data files or also images that's available on the site. We have other data resources on specific topics. Debbie started in reminding us around the loss of life that's happened during the COVID-19 pandemic and other challenges that we all have been experiencing. I was getting very teary-eyed thinking about what this has meant, and we've been trying at Citizens Committee for Children to really understand the COVID-19 pandemic, the economic fallout, the racial injustices that have been, all of these things have been overlapping at the same time and have not aside from the pandemic, some of these concerns have existed for decades. And so what we tried to do is put together as many data resources to inform what was going on over the last year. And I've included some links to this for you all, and I'm happy to share the slide deck so all of this can be available to you. So why do we produce these data resources? Why put all this energy into research and data? Well, because like I said, we're using information to monitor trends, to inform our advocacy. If we only looked at citywide data, and let's say we looked at the federal poverty level, meaning the share of families who are experiencing very low incomes, over time, we see that, you know, the poverty rate actually increased, especially after the recession in 2008, and it's gone down since. And that's kind of like a rosy picture that we've been looking at. But if we actually break this down for families with children, separate from families without children, we see that the differences in the share of families who are experiencing poverty was very, very different from the average for New York City. It was as high as 1 in 4 families with children experiencing poverty around 2010. If we break this down further, we see that it's not just about families, but it's about the racial and also gender-based discrimination that families face. So what this chart is showing is the child poverty rate by race, ethnicity, and household type being whether the head of household is a single mother, a single father, or a married couple. So on the left-hand side, you see Latino headed or Latino and Latina headed households. Black households are second from the left. Other is a category that doesn't fit neatly into these other 4, which in addition to Latino and Black are Asian and white. And so you see that within these gender and racial demographic groups, huge differences in the share of children who are experiencing poverty. Half of children, or almost half in the Latino and Black single mother households, are experiencing poverty. So when we talk about poverty and the material hardship and kind of real qualitative differences this makes in children's lives, we really are producing these data resources to shine a light on issues that must be addressed, inequities that must be addressed. There's really no patience that we should have for them. We've been trying to do this more recently with data from what's called the Household Pulse Survey. It's an experimental product from the US Census Bureau. It's not the decennial census that came out last year. It's not what is the American Community Survey, which is an annual survey that the Census Bureau puts out, where most of the data that we use comes from, and the data that I just shared with you comes from. We're going to be sharing some findings from our analysis of the Household Pulse Survey data on Monday. So I put a link down here to the webinar on Monday. If you go to our website, you can register for it. And part of what I want to just show here is that during the pandemic, the top 3 lines, if we look only at the city, households, about half of households have reported in the New York City metro area that they've lost income since March 13th, 2020. But for households with children, this is 60%. And then if we look at households with children broken down by race, ethnicity, or by income level, we see that sometimes 2/3 or even 3/4 of different demographic groups have lost income. This has been devastating in multiple ways. When we look at the COVID-19 data, I think something interesting is happening with Staten Island, where there's a really high rate of cases, COVID-19 cases, but relatively speaking to other boroughs, hospitalizations and also deaths have been lower. So there are some borough level dynamics that are important to understand why this is happening. This is part of what we tried to do when we were conducting our project in the North Shore of Staten Island. We knew that in speaking with some of our partners and the folks that asked us to do this project, which was the Staten Island Foundation, they said people don't understand the North Shore separate from the borough as a whole, and that we really need to break down some misconceptions. One of them being, what are the demographics of the North Shore? The North Shore demographics actually mirror New York City as a whole, meaning that the share of the racial ethnic demographics, for example, is very similar for the New York City as a whole, which is a racially and ethnically diverse city. This is different than Staten Island as a whole, which has about 2/3 of the population are white, whereas for the North Shore, it's about a third. And then again, like a racially, ethnically representative group.
Yeah.
We also wanted to show that the borough level trends, not everyone has high incomes in the borough of Staten Island. And one of the things from our Child and Family Wellbeing Index is that we were concerned that over the last decade, multiple indicators for the North Shore have been trending in the wrong direction. So what you see at the top line where it says St. George 17, 17 is the rank out of 59 community districts where there's multiple overlaps of barriers to well-being. If you're ranked number 1, that means there's the greatest degree of overlap of barriers to well-being. If you're ranked 59, it's the lowest. And between 2010 to 2017, the North Shore jumped from about the mid-range of the pack of the 59 community districts to the top third of the pack, ranked 17 out of 59. So this was concerning. And some of what I'm going to be going over today is going to dig a little bit deeper into that. And that's part of what our community-based assessment tried to do, is to take this kind of large trend and to say, how can we go deeper? Who do we need to be speaking with to be able to understand this? And the community-based assessment had multiple components, one of which was looking at data like I've been sharing with you so far. But another component was speaking with organizations and families who have that lived experience of what is going on to complement the data, speak back to it, share a different story, or share ways that we should be looking at quantitative data differently. So what we did, it was similar to what we did in other community-based assessments, where we looked at the public data. We had what we call community engagement, where we did interviews with service providers. We also hosted focus groups or listening sessions with families and young people. We used a variety of methods to do this. Often we use something that I call theatrical analysis, where people actually play out a skit about families that are doing well on the North Shore or families that are not doing well on the North Shore. What this allows participants in a focus group to do are to tell stories without necessarily having to say, this is what happens to me, or this is my story. And in that way, they are being able to identify issues that are deserving of further discussion as a group, or investigation in our qualitative and quantitative analysis. We did a lot of what we call asset mapping through these conversations, identifying where are the community resources. These could be individuals, organizations, institutions, or infrastructure that support the well-being of families. And in addition to talking to people about this, we also looked at public data that actually map these out. Where are the locations of things like banks, like food retail, like emergency food assistance, things like that. The objectives are similar to what I've described before. We wanted to identify both welcomed and worrisome trends for children, youth, and families. We wanted to complement the quantitative data with qualitative data from the voices of folks who know the North Shore at the best, which are the people who live there, including service providers who might not live there, but also work there. But many of the folks that we spoke to were both residents and workers on the North Shore. And like I said, we wanted to map existing resources that tell not just the story of gloom and doom, but also say, what are the strengths of the community? Where are the resources that we want to expand, or if there's things that we really need to highlight as successes and celebrate, what are those too? And that was part of our process. So I'm going to be going over some findings from the report, as well as more recently about the North Shore. It hasn't been too many years actually since we've released the report. 2018 is not so long ago, but some important changes have happened since we published the data in that report. So at the time, our report was showing that for the overall poverty rate, so this is all families, not just families with children, the blue line is the North Shore, the orange line is Staten Island. And you see these that over the decade that we were reporting, this line was trending in the wrong direction, meaning the poverty rate was going up. As many as 1 in 5 children, or 1 in 5 people were experiencing poverty. For New York City, it was more or less stable. In the time since, we've seen some things trending in the right direction, generally speaking, where the poverty rate or the number of children in households under the federal poverty level, which right now for a family of 4, So let's call it 2 adults, 2 children. The federal poverty level is around $25,000. So we see that for those families that are underneath that level, since we reported in 2016, I hope you can see my cursor, the share of families, children in those households has actually gone down, which is great. However, when we look at this orange section, which is the bar on top, this is what is 100 to 200% of the federal poverty level. So for a family of 4, this would be those earning $50,000 or less than $50,000 a year. In New York City, $50,000 only gets you so far, especially when you have 2 children, and especially when you're considering things like childcare, which for children under 5, it's tens of thousands of dollars, anywhere between $10,000 to almost $20,000 if you're looking for infant care at a center, for example, which would be what we consider high quality care. So while the number of children below the federal poverty level has been decreasing over this time, we do see, I wouldn't call it like a drastic change, but this share of children who are in this 100 to 200% poverty level is going slightly up. And we really want to be thinking about this group as we continue, because in situations where a family is 1 paycheck away from dipping below and entering what would be considered poverty, this makes a huge difference. And so this is why things like the federal stimulus were so critical in actually lifting families out of poverty throughout 2020, and things like the tax incentives and supports that are coming to family in the new acts that Congress has been making are really critical, and that we need to sustain those over time, not just during a pandemic. Similar to what I was saying before in terms of disaggregating information, because we really need to be talking about not inherent differences between racial and ethnic groups, but the systemic racism and discrimination that people experience that is really what in fact affects their wages. It affects the opportunities that they have in multiple ways. So we disaggregated this information. This is available on our website, our database. So we see that most of the children who are in households under this 100% of the federal poverty level are either Latino or Black. And so when we're talking about poverty on the North Shore, we're talking mainly about children of color. There are very few children amongst the 40,000 children on the North Shore who are Asian, and there's a smaller population of them who are experiencing poverty, and same is true for children who are white. So when we're talking about this, there really is systemic racism and discrimination that is critical to be addressing when we talk about addressing poverty for children on the North Shore. Something that's interesting to take a look at is a little bit more that we might talk about this at another time, is when we think about income diversity ratio, this is thinking about when you take the top 80 percentile of incomes and you take the 20th percentile of incomes and you compare them, how many times more are people at the top making than at the bottom? And the North Shore actually has one of the greatest differences in those top and bottom comparisons, whereby if by a factor of 8, meaning that folks at the top were making 8 times the income that folks at the lower 20 percentile range were making. This chart that says that St. George ranks 4th. So St. George, North Shore, St. George is kind of like the alternative name in the data sets that we use for the North Shore. We see that the difference between these income percentiles has kind of like fluctuated, and most recently it's been going down, meaning the difference between the top and the bottom has been decreasing. Part of that is because poverty has been going down, but then there's multiple things that we can probably be talking about. This incomes overall have been going up for families in the North Shore. So compared to 2011 and 2019, it was more than $10,000 higher for the median income, which is actually a pretty big difference in less than 10 years. However, we should be noting though, income inequality across the city, wages have really stagnated for the lowest income families, while they have really increased citywide for the highest income families. One of the things we did in the project, and we can't always do it in our online resources because this does take a bit of work, is really go down to what we call census tracts or neighborhood tabulation areas, which are collections of census tracts to really get as granular as possible for the neighborhoods. And so here's where we see the income inequality, or really what that previous chart was showing was just income diversity. The red areas are showing, oh, I'm getting a little bit of feedback. I hope that's not causing too much. So the red areas are showing, am I the only one hearing that?
I hear it too.
Okay.
Probably people should turn off their mics if they haven't.
The red areas are showing where there's the lowest median. Oh, it's gone. Great. Thank you so much to whoever helped me out with that. The red areas are showing where the lowest income census tracts, and the blue, actually the lighter blues, not the darker blues, are showing where there's the highest income tracts. And so when we think about our lived experience about the North Shore, some of this might make sense to you, but some of it might not. I think part of it too is that when we think about income groups, there are some public housing developments on the North Shore, which the incomes might be lower, and that's part of the reason why people are eligible to be living in public housing. For example, Mariners Harbor, there's a public housing complex, and so that's part of where it might be explaining these geographic differences as well. Something that's interesting when we were doing our project is that the median rent, or rent just as an issue, was really a concern for people that we were talking to during the project. Even though median rent relative to the city is much lower in Staten Island and specifically the North Shore, but there was what we were calling, what others are calling, gentrification happening on the North Shore, with the building of the outlets, and kind of at the time there was discussion around the Ferris wheel that was being built, and people were thinking that changes in rent were to draw folks that weren't the folks who were already living on the North Shore. And there was concerns about this, even though the changes for median rent for the North Shore wasn't as drastic as other parts of the city. It was too much for many families to bear. And what we call it rent burden. What is the share of people for which housing costs are more than it should be as a share of their annual income or as a monthly income? When a family or household is spending more than half their income just on rent, we call this severe rent burden. And at the time in 2016, when we were reporting on the data, that was the most recent data available when we were releasing our report, which was for 2016, 1/3 of all households on the North Shore were spending more than half their income on rent. And 2/3 of low income households, those that are under the 100% federal poverty level, were spending more than half their income on rent. And this is just incredible. What's crazy is that this is also happening across the city and the borough too. and so this is really a citywide issue. The housing affordability crisis is a huge issue prior to COVID. And I think during COVID, we really are seeing a huge need to really support families with their housing security. Even right before COVID, we were seeing some better numbers, meaning that relative to the city, the North Shore, and the borough as a whole, the share of households that were experiencing rent burden, severe rent burden, was dropping since we were reporting on a report. So if you see the previous graph kind of looked at these two time points from 2013 to 2016, and then since then, the most recent data for 2019, North Shore and Staten Island, the share of families has gone down. So instead of 1/3, it's about 1 in 5. This is good, but we still haven't done a full accounting of what those challenges are after, or during, and what hopefully will be after the pandemic. I'm going to move on to some educational outcomes and try to be very, very brief. For both math and ELA, I think there's concerns around how people are going to be evaluating learning as we move beyond the pandemic. The North Shore is in the middle, and what this graph is showing is trying to show the math and ELA rates, pass rates for not just Richmond County, Staten Island, and New York City, which is all the way on the right-hand side, but also relative to other counties. So Nassau County in Long Island has the highest share of children who are passing math and ELA. Franklin County in upstate New York has the lowest share. And so the North Shore is probably in the middle of the pack. And this is kind of insane, though, that 1 in 3 children are passing math, and about 40% are passing ELA. It's still very, very low, even though it's in kind of the middle of the pack. And this report, I linked to it here where it talks more about the statewide work. A key concern for us right now, based on partner organizations that I've been tuned into and that Adrienne and Sarah have been tuned into, is this issue of IEPs. Staten Island as a borough, but as a district, since D31 is the whole borough, has one of the largest number of IEPs, definitely in the city and even in the country. Many of these are concentrated in the North Shore. And so there is a need to dive in deeper as to how can we be supporting students on the North Shore, especially those who are categorized as having a disability. We did a lot, as much as possible, based on feedback from people we were talking to. Education was a key issue when we were talking to folks on the North Shore during the report. Things like what's called the Economic Need Index. The Department of Education, you may be familiar, uses multiple measures to say what is the economic need of students in a particular school. And something that we were finding was that as the students became more overcrowded, the economic need was actually lower, which was suggesting, and this was kind of backed up by the folks we were talking to, is that families who had means were trying to get their children into schools that they perceived to be higher quality or had better outcomes. And schools that were having higher economic need were actually underutilized. And so what this is showing is the blue lines are showing those schools that have a higher economic need above the New York City average, and the red is showing below the city average. And what the y-axis is the pupil to teacher ratio. So almost 18 or around 17 students per teacher in some of the lower economic need schools, and then lower around 10 students per teacher in the higher economic need. This is interesting to us. It's something that I love to talk to you more about. Maybe it's something insignificant, but I found it to be something interesting to note. In talking about equity issues, like educational equity issues, we want there to be good resources for schools, and part of that is investing in the human resources of schools. Teachers with multiple years of experience, with master's degrees, and having that certification to be teaching. And we see that for the North Shore relative to other parts of the island, there are less teachers compared to the South Shore that have, or I should say, there are more teachers with less than 3 years of experience on the North Shore compared to the South Shore. There are fewer teachers with master's degrees or higher teaching in North Shore schools compared to Mid-Island or South Shore schools. And then this chart that's all the way on the bottom right is showing the share of teachers who are teaching out of certification. And actually, interestingly here, there's actually a fewer share of teachers teaching out of certification on the North Shore compared to other parts of the borough. The last topic that I want to touch on is the transportation issues that we constantly were talking to folks about in our qualitative work. It really was something that people were very much concerned about. And I have a snapshot of some of the quotes that we heard during focus groups with either caregivers or young people, where people were like, the second bullet, transportation is difficult with young children, especially navigating strollers on crowded buses. Buses are a main means that families in the North Shore are getting around. And so what we tried to do was to understand the transportation issues more. On the North Shore, what's interesting is relative to the island or the city, more people who work are commuting less than 30 minutes, but also compared to the city, but also more of them are commuting more than an hour. So you either have a short commute or you have a much longer commute. When we think about the means of transportation, many of this might be common sense to all of you, but for us, it was something important to highlight in our report. Whether you have low income, medium, moderate income, or higher incomes, your mode of transportation might look different. And so we see that the lower income, or what we were calling near poor, so this is this 100 to 200% of federal poverty that I was highlighting earlier, are more reliant on the bus, which is the the red column showing that 40% of people who are relying on public transport, of low-income workers are relying on the buses. So the buses are really something that we wanted to take a look at. This is showing the frequency of bus trips with the red, darker red, and then oranges showing where there's more bus trips. The blue lines are the bus lines. I understand this might be very, very detailed, and so I'm not going to go into too much of the detail, but just to say, it's not surprising that there are a lot of bus trips near the ferry terminal, but it's not just about people going to and from the ferry. There's actually, what we were doing is mapping assets and infrastructure on the North Shore, and there's a lot of services available on the North Shore too. So NYCHA housing, homeless shelters, housing support services. You see this clustering of services on the North Shore. This might be offices, or might be organizations that have satellite offices that aren't represented in some of the data that we have. But the point is that it's not just with housing support services, but for many different mental health facilities, they're kind of concentrated on this eastern side of the North Shore. For emergency food assistance, again, things are concentrated in the St. George eastern part of the North Shore. Something else that we did was look at access to banks as well as food retail. And so what this map is showing is the red areas are further than a 15-minute bus ride to a bank. The blue dots are the banks themselves. And so thinking about financial assets or banks being a means for people to support their financial equity, we tried to provide this information. And I actually feel like we tried to provide some information about access to food retail. The blue dots in this map are actually traditional food retail, which we define as 10,000 square foot supermarkets, really. And the darkest orange areas are those that are further than a 15-minute bus ride. The lighter orange areas are those that are within a 15-minute bus ride. And then the little yellow areas are within a quarter-mile walk of those areas. And actually, Adrienne and others did a really great report that we relied on and cited in our report about food access to these traditional food retail places, and has much more detail that I think would be very interesting if anyone has interest in that to take a look at it. There were multiple solutions that people shared. Most importantly, and I think Kelly, and speaking with you and the work that you were doing, people want co-located services. We want to be able to really leverage the assets that we have in more than one ways. Libraries are one place that multiple things can be happening at once, but a lot of the ideas that Kelly and also Adrienne's organizations have worked on to have multiple services in one place in a way that normalize supports for families is really important in what we heard. So how do we take action about supporting this and some of the issues that I shared earlier? Well, there are multiple collective impact initiatives on Staten Island, which I was really happy to learn about. We list those as part of an appendix in our report. And if you'd like to get involved with CCC, specifically our citywide and our statewide actions, I really encourage you to follow us on social media so you know what we're up to. You can sign up for what we call our e-action network by going to our website in this URL here where it says cccnewyork.org/sign-up is where you'll be getting all the information about our advocacy work, letter writing campaigns, anytime we release a new data resource, including a report that we're releasing on Monday. You'll get that in your inbox. We're part of multiple coalitions that focus on specific issues around children and families. Behavioral health is a big one right now. It's the Campaign for Healthy Minds, Healthy Kids. The Campaign for Children is something that focuses really right now on access to infant and toddler care and expansion of the universal programs. We're really happy that there's new money in the budget for the city to expand 3K for all through, especially a full-blown in 2023. And there's other issues that we advocate on that I encourage you to take a look at on our website. We also have what we call a community leadership course and a youth community leadership course, which is a multi-week program where participants learn about key issues that are facing children and families in the city. Myself and my colleagues share data. Adrienne and Kelly have both been guest speakers on that program. It's really fun, and I think gets a really good 360 view of challenges and opportunities that children and families in New York City face. I'm excited to say that we're going to be releasing information from a survey of youth that we did earlier this year. We spoke to over 1,300 14 to 24-year-olds in New York City about what their priorities are for the next mayor and the next city council that are being voted in this year and then take office in 2022. I encourage you all to participate in our May 26th event, or I'd be happy to share more information in the future. And these are some links that you can use, including my own email address, if there's anything that I haven't covered today or that you'd like me to speak about more, or you want to tell me that I got something wrong. I'd love to hear from you.
I think that if it's okay for me to speak, I think that Bijan and the Citizens Committee for Children did Staten Island a very big favor on the North Shore. You know, for years, whenever funders are looking at Staten Island, they're looking at the whole borough. And so the thought was that Staten Island was white, and that Staten Island, everybody made $70,000 a year, and everybody worked for, was a police officer, a teacher, or a fireman. That's what the outside world believed about Staten Island. With this report, what it did was gave us the ammunition to go out there and share with various funding sources and various other citywide government officials and kind of bring them up to date on the needs of Staten Island. We have in the 49th district, we had one representative who was on our side fighting for Staten Island children, and she was alone. Debbie Rose was alone. And we really needed to rally around some of those issues and also fight for things that we needed on Staten Island. Bijan, I mean, I just wanted to say that up front. I know that I can go on and on, but I just wanted to thank Bijan and Citizens Committee for Children on this report, because it was so important. And for me, it really helped. And for my organization, it really helped us lift the conversation on so many levels in so many places about the North Shore. It gave us the ability to point to these statistics and say, this is what's going on Staten Island. This is what's going on in this district. It's almost parallel to what's happening in communities like Washington Heights or Harlem, etc. Except we're not getting all the resources to deal with them. So we're very grateful for this. I hope that we do another report and get this updated. So I've always, so thank you. I want to thank you publicly, Bijan, for this report, because it really, really helped lift these numbers, the numbers that we all inside knew, but we needed a source to be able to point to say, this is who Staten Island is. And that's really important when you're out there fighting for resources.
Hi, Kelly. Did you want me to introduce you, or do you want to go into your presentation yourself? Because
to save time, you don't have to talk about me. I just I'll just go right into a few notes that I want to share, if that's okay, Debbie.
All right.
So, it was great speaking with Bijan and others. It really created a deper conversation. And I also want to give a big shout out to Betsy, at Staten Island Foundation. May she rest in peace. And I'm sure she's hooting and hollering right now, looking down on this conversation, because she really helped to make this happen. I'm talking about Betsy Dabowski. So a few things, that I felt were happening. One is that in 2015, there was a study that was done. It was a national study that Harvard University had entered into about they were taking a look or surveying the poorest counties in the country. And one of the things that they found was that in 2015, and this report came out in 2015, was that Staten Island was actually named one of the worst poor counties in the country. Not the worst in terms of being poor, because we certainly don't have the most poor people, but being the worst in terms of not having enough resources for the poor people we do have. So that was really, really telling to me that here we came in as one of the worst counties to be poor. It was better to be poor in East Harlem. It was better to be poor in Bed-Stuy because the resources were there. And that hurts us over and over. And that's how come resources are so important. When you take a look, for example, at, I think I shared this with Bijan, I always feel like Staten Island, because of our lack of resources, a couple of things happen. One, we have probably one of the best, highest volunteerism rates. That's the bright side around. We have more volunteers that roll up their sleeves. I worked for quite a bit of my working career in Harlem, where I was born and raised. And volunteerism is not that high there, but resources are really high there. And here in Staten Island, it's the opposite. It's the resources may not always be there, but there's always somebody who's going to roll up their sleeve and help you out, who's willing to do that. So I always felt like that was the most beautiful thing about Staten Island. But we still need to fight for the resources. We still need to be able to do that. So one of the things that we felt was that we had to, Staten Island tends to, and this is a generalization, but you can look at the statistics on this, is that whenever we get stuck, we kind of relegate young people to another system. I don't know a better way of saying that. Maybe somebody else can come up with a nicer way of saying that. But when you take a look, for example, at DOE and suspensions and transfers, those are pretty high in Staten Island. When you take a look at the IEPs, I'm not quite sure, and I'm sure Sarah is a way better expert than I am on IEPs, but I know that Staten Island has the highest number of IEPs in the city. How could that be? And we're the smallest. We have more young people in special education in the city than the Bronx. So to me, that's very telling. One of the questions I always have is, I'm not really sure why. I'm not convinced, because to my knowledge, there's not been a real study as to why that is. I think that it's part of it might be what I call relegation. In other words, young people are difficult to deal with. We don't have the resources to help them, so we're just gonna put them into special education. That's one. The other is, it might be an environmental issue. We also have a very high rate of young people who are born with developmental disabilities, and autism is very high in the borough. I don't know if that's an environmental issue, and there has not been a study on that, and I wish there were. So there's those reasons. So I really feel like that's one thing that really needs to get looked at, in addition to, I'm sure Sarah has another list of IEP issues that we need to do that. But that to me is another point of relegation. Another is foster care. If you take a look at the monthly rates that children go into foster care, Staten Island is higher than even a community like Washington Heights. So if you compare us, and Washington Heights is way more populated, and by numbers, we have more young people going into foster care on a regular basis. And then you look at homelessness, 7 out of 10, I think this is the Institute on Homeless. Bijan, you can help me with the name of the report. I have it right here. But according to them, 7 out of 10 high school young people who are homeless drop out. So if I'm in high school and my family becomes homeless, 7 out of 10 young people in high school who are homeless drop out from Staten Island, because we get relegated into a system that forces us to live in the Bronx, even though we go to Curtis High School or we go to Tottenville High School. So it's a really, really serious problem not having resources. The other thing is in terms of space and in terms of community, you know, physical assets, I think also contribute to poverty and needs on Staten Island, especially when it comes to young people. So things like fighting for Cromwell, you know, thank God it's coming about. You know, I would say I wish it was going to be a bigger space, and I hope that the powers that be look at other kinds of assets to help with that. But you know, some place like Cromwell, you know, that when Cromwell, when we started the Let's Rebuild Cromwell Coalition, that month, a 13-year-old boy was killed in an elevator shaft from the old hospital, remember the old abandoned hospital? He was killed like that month that we had announced that we were going to do this coalition. And it was just a stone's throw away from where Cromwell was. And why was he in that abandoned building? Because he was playing. Didn't have a space. It wasn't evident to be in any other space to play other than that building. And I think that if Cromwell had been around, there were a lot of issues in our community that I believe, you know, either could have been different, could have had different outcomes. You know, after Cromwell, the next biggest space that's run by the Parks Department to have recreational activity only held 40 people. And that was over in the Snug Harbor area. I forgot the name of where the tennis court is. So it's really amazing to me that we had been gone this long without a facility like that. And I really believe that there are different points and data points that we could look at related to not having that facility. So many. It was one of what I was fascinated about with Cromwell was that how natural it was. It was a place where people of all ethnicities, all economic backgrounds came together on a regular basis. Even if you know, you'd find a judge, you know, who was from the courthouse down the block, you know, having a pickup game of basketball with some NYCHA kid. It was the most natural place. And once that place disappeared, because there were 1,000 people that came into Cromwell in a given day, that many people don't congregate anywhere on Staten Island other than a school. So that was a very, very, very important place. And I feel there are other assets like that, you know, like the idea of, you know, getting more park areas for our community. I mean, I can go on and on about what young people need in this community. This report certainly gives us the ammunition to go. Even there's very little update to do on this report, let me tell you. But there's so much work and so much ammunition, but we have to fight. I'll just wrap up with this. So our organization, one of the things that we try to do is also look at what are some of the community assets that help make life in our neighborhoods and the life of children better. So we look at things like parks. So I'm always partnering with Sarah Blass and others to make sure that our parks are there for young people. You know, we had some activities just about 2 years ago over at Friends of Tompkinsville Park. And we got told by one of the teachers at PS16, I'm not bringing children here anymore because this is not a place for children. And that was heartbreaking. That was really heartbreaking. And that activated us to start doing things in the park to bring young people back, you know, and that's our goal, and to bring families back. So we're doing all kinds of things. That's why we started working with creating a Friends of Tompkinsville Park. and doing these things and partnering with Partnership for Parks and others, and doing things about bringing, because that is a centerpiece for Tompkinsville, for St. George, for the North Shore. You know, that particular park has so much around it, all these resources that exist in our community. We have a family alternative housing facility that's going to be built right there. We need to be ready for that. I mean, I think that that's our next charge. You know, if anybody's going to volunteer for something, let's start getting involved with helping, you know, to welcome those families, to help those families, because we have a serious, you know, lack of housing available, and we need to do something about our families and other families. You know, we're part of New York City, so we have to do something about helping families survive and thrive, you know, in New York City. And having a homeless shelter is part of that. I know there's a lot of people in our community that are not happy about that. I won't say anything more about that, but I got to tell you, it's a very needed facility and very needed resource in our community. So I'll stop there because I'm sure people have questions and things like that. And I would definitely want to hear from Adrienne and Sarah.
Okay, thank you. We're now going to go on to our next speaker. Adrienne Abatte is the Executive Director of the Staten Island Partnership for Community Wellness, and she's going to speak about her organization's involvement with advocating for public health and social justice issues. She's an ardent advocate of public health and social justice issues with over 20 years of experience that span the private, public, and the government sectors. And she's the founding executive director of the Staten Island Partnership for Community Wellness, a nonprofit working to create a healthier Staten Island through cross-sectoral partnerships that address emerging health needs. So we look forward to hearing you, Adrienne.
Thank you. Great. And thank you for the introduction. You didn't need to do that. I want to just echo what Kelly mentioned about our appreciation for Citizens Committee and Bijan for his work in spearheading the North Shore report and engaging all of us in surfacing these issues and validating what we've been seeing for years. So it was such an important report, and we're so happy to have them as our partners. So you heard a little bit, I guess you just heard in my bio about SIPCW, but we are a public health nonprofit. We are working to address systemic issues that contribute to poor health outcomes. And we're rooted in this understanding that the issues that we're working on have been generations in the making and are not easy to solve and cannot be done by any one organization alone. And I think Kelly really highlighted the importance of having so many partners and volunteers, but even cross-sectoral representation in the work, like having the different expertise and resources that people can knit together to address these issues. So what we try to do is be the bridge between these networks of partners and community voice so that we can co-create some strategies and work on these topics. Similar to Citizens Committee, we do some data collection, and we've been disaggregating to see how these different issues are impacting Staten Island as a whole and then specific communities. We work with our partners to take that data to prioritize issues to work on. We build networks and coalitions. We do some community education and advocacy campaigns. And then to Kelly's point, we try to bring funding into the borough for our partners and to also scale programs that the city might be having it, this happens all the time at DOE. We'll hear about a project or program. I was like, that's amazing. What Staten Island schools are you in? Oh, we don't have anything on Staten Island. Oh, nobody responded from Staten Island. So we're like, it's very frustrating. So we try to make sure that Staten Island schools partners know about citywide opportunities so that we can scale programs across the city and into our borough. I'm not going to go over everything that we do because I mentioned it a little bit in that prior slide, but I just want to highlight that we're supporting 2 cross-sectoral collective impact projects. One is called TISA, which is focusing on behavioral health among youth and young adults on Staten Island. It's almost a decade now old, which is pretty cool. And then the Staten Island Child Wellness Initiative, which is working to reduce the burden of chronic disease across Staten Island, but with more targeted efforts on the North Shore. We also support some discrete public health projects like Project Launch with Rumsey, America's Promise Alliance, which, to Kelly's point, is about centering youth in driving both research and policy solutions impacting school-age children on the island. We work with the Staten Island Performing Provider System on their population health, behavioral health projects. And then we provide some support to Youth Wins, which is a workforce initiative focusing on 18 to 24-year-olds on the North Shore and connecting them to career opportunities. I didn't include any data slides because you got so much from Bijan's presentation, but I did want to just kind of highlight on the North Shore, we also see tremendous health disparities in terms of asthma rates. Children on the North Shore ZIPs have higher ED utilization because of asthma, higher obesity rates, and that's sort of the genesis and impetus behind the Child Wellness Initiative. So when we were talking about sort of these disparate outcomes in terms of health, we know that health is driven partially by individual behavior, but what we really know is that the social determinants of health are really what's impacting people's ability to thrive. And Bijan kind of touched on these different components, and Kelly did too, like about just how neighborhoods support people in whether they can thrive or if they're going to be experiencing barriers. So you hear social determinants of health a lot, and it sounds jargony, but it's really just thinking about where people live, work, play, pray, and even receive healthcare, and how those conditions can impact people's ability to thrive. So another thing, I feel like when Debbie was talking about COVID-19 and George Floyd and this confluence of social justice, racial justice, and public health, that it's created this opportunity. So at an organization like SFPCW, we've been talking about health disparities for 20 years, but what we haven't been doing is really naming the structural conditions that have been contributing to the poor health outcomes. So I really like this revised social determinant of health framework that Ruqaiya Yerbi just put out this past year, because it shows the root causes of these issues that we're all working on in the community, right? So we can talk about health and well-being and kind of some of these poor outcomes, and then looking at the systems, thinking about how it impacts health and well-being. So I can take neighborhood and built environment, and Kelly touched on this, but like ability to access parks, quality housing, like, for our asthma initiative, seeing housing quality and, mildew, pests, all these things impact asthma and people's ability to thrive, right? So all these things, if you go back a layer to a tool, in the tool column, you see that these things are impacted by laws and policies. And this could even be just budgetary decisions about how things are funded. So for the neighborhood and built environment piece, I know we hear a lot about redlining, but these decisions about who gets to own homes, how investments are made in communities have these long-standing impacts, and how it's showing up in something like health and well-being. And if you go one layer back, the laws around mortgages are the root cause of it, or this is structural discrimination and the structural racism. So I like this because, you'll see more and more frequently that racism is a public health issue, and people are like, oh, stay in your lane. Why are you working on housing? Why are you working on workforce? Because it's all interconnected, and it's because of these structural issues that are contributing to these pieces. So I feel like lately people are naming it, and this is where we're going. And I thought it was a nice graphic to kind of show why some communities have had these disinvestments, like thinking back to Bijan's slides with the transportation infrastructure and looking at Mariners Harbor all the way out there without banks, without grocery stores, without bus lines. These are all things that are impacting people's ability in that neighborhood to thrive. It impacts the education quality. So all these things are as layers and of complexity, but when you get at the root cause, are these structural layers of oppression. So it's a lot. Excuse me. So thinking about what we can be doing and what we're doing at SFPCW and where like Peace Action can come in and help us with advocacy is to really continue to center race and social justice as we're thinking about not only health policy, but education policy and community development. One of the best things about SFPCW is our ability to bring partners together and build the capacity of some of the partners who might not be thinking in this way. So we've been really taking this moment in history to do capacity building around anti-racist practices among our providers and our programs to bring more people into the work. Thinking specifically about activities to improve the built environment on the North Shore. So you're going to hear a little bit more about this from Sarah Blass, and Kelly touched on this, but just making sure that people have access to healthy retail, fresh produce. You know, we had very high childhood obesity rates in some North Shore neighborhoods, but then you look and there are food deserts, and what people can get are cheap, highly processed foods. So it's not only about increasing opportunities for people to access healthy foods, but also trying to decrease opportunities to eat the stuff that makes you sick. Another big thing that we are working on, and we could use more community voice, is advocating for things like bike share programs. So for a brief period in history, we had 2, Jump and Lime, and it was fantastic. They were dockless. Everybody was using them. I mean, kids of all ages and backgrounds. It felt like a wonderful equalizer in terms of access. And then it went away. And there have been promises about it coming back, and we're crossing our fingers and toes that we get something soon. But this is something we need voice and advocacy around. And then open streets. So for bike share programs in open streets, we've been working very closely with our partner Transportation Alternatives. Rose Shanowski is the lead on the island, but just trying to get more spaces where we can take roads and convert them to spaces where we can recreate and have, you know, almost like extend the park into the street. So this has been a tremendous push, and I know that actually there have been some successes, so open streets are coming back. But these are examples of how the community can lend their voice. We can have a whole session on safe and affordable housing, but this is a real driver of disparate health outcomes, especially on the North Shore, and something that needs to be addressed as we are bringing in new city council members, a new mayor. We need to have a strong voice around safe and affordable housing, and to Kelly's point, housing at all levels. And then expanding community gardens and park access. We are the Borough of Parks. Not everybody can access the parks. You might have a park in your neighborhood, but is it, you know, are there sidewalks that are broken? Can you get there? Is there programming in that park? Is it the same level of programming as a park in another area of Staten Island? So there's a lot that we can be doing around park access and equity. And I am thankful to Partnership for Parks and the Catalyst program, because I know they've been doing a lot of wonderful investments in programming in North Shore parks. And then my last one, and I could go on and on around many more topics, but this was something that we just wanted to highlight through the work of TISA. We've been seeing tremendous increase in behavioral health issues among children and adolescents as a result of COVID, the social isolation. We've seen increases in depression, anxiety, and suicide ideation. It's starting at a very young age, so it's very troubling. And what we're finding is that there's just not enough services to handle the increase and the severity of the need. So in terms of advocacy, we're trying to advocate to get more behavioral health, specifically mental health services in outpatient settings for children across the borough. And then also increase in SUD use, so that's substance use disorder, so SUD issues. And we've done some disaggregating of data and are seeing that it's impacting, though we've been seeing opioids go down, if you disaggregate the data and look, you see that it's actually going up among some of the BIPOC youth on the island. So I get this idea, to Kelly's point, of like people think that Staten Island is all white, 72,000, and that opioids is a white issue. We're trying to dispel that and to show that there's need in different populations, and that we need to keep the attention on the issue, we need to bring in resources, and we need to build a cultural competence of the providers to meet these needs. So this is my last one. Like we've heard through our partners that there's only 2 or 3 Spanish-speaking drug counselors in these programs. So this is a problem. So we need to kind of build the capacity of our partners to understand these issues and to meet the needs of Staten Island children, because these needs are becoming more intense right now in this COVID period and in the foreseeable future. So I just spoke, I gave you a lot of information. I don't know if people have questions, but if anybody wants to follow us or join one of our coalitions to help us address these issues, we would love to have more hands on deck. And thank you all for this opportunity.
Okay, we're going to have our last speaker is going to be Sarah Blass, and then I'll give some closing remarks. Sarah Blass is presently running to become an elected member of the Community Education Council. Sarah Blass serves as the Equity and Community Impact Lead of the Staten Island Partnership for Community Wellness. She's a Staten Island resident and parent of school-age children, and she serves as the Director of Diversity, Equity, Inclusion for SWIM, and she is also the founder and Executive Director of Staten Island Therapeutic Gardens. Sarah?
Thank you so much for that amazing introduction. I'm so excited to be here with Peace Action Network of Staten Island. It's amazing that you all hold these spaces to have these extremely important conversations. So to be a part of it, to feel safe in this space, to really talk about my own lived experiences is really just so important. And a very important step to really beginning to make sure that we see an equitable distribution of resources within the education system here on Staten Island. So I'm going to talk a little bit about myself as a mom. I'm a mom of 6 beautiful babies, all of which go to school here. 5 out of 6 actually go to school here on Staten Island. And then I'll be talking a little bit about the Community Education Council and those seats that I am running for, and how people can really plug in not only to vote, but to really talk about some of the things that all of the speakers talked about today and how we can begin to make changes throughout the DOE. So IEP, lots of our speakers talked a little bit about IEPs, and I want to do some level settings because I know that our audience is mixed and the recording will be going out to a mixed audience. So IEP is an individual education plan. It's also known as special education. And what does that mean? It basically means that a child needs either related services, so that can be speech, physical therapy, occupational therapy, a para, adaptive physical education, or sometimes counseling. And it can be just one of those things or a combination of those things to really be able to make sure that that child has everything that they need to excel in a school setting, to meet their potential in a school setting. So that's what we're talking about. We're talking about IEPs or special education. So I'm going to share some really interesting statistics about Staten Island, and Kelly touched a little bit on that. I'm going to go a little bit deeper into that, and there are longer presentations that I have. So if you're interested in like a deeper dive into this, I'm going to throw my email in the chat, and I'd love to do one-on-ones with people to really talk about it. So Staten Island is, as Kelly said, the highest percentage out of all the boroughs with IEPs. So 24% of students have IEPs here on Staten Island. That is a lot. That equates to 15,000 children. So 15,000 children have IEPs here on Staten Island. The Bronx, 23%, Brooklyn, 19%, Queens, 16%. And again, when we talk about that, why is that, right? Is it because children here just happen to have a higher need for IEPs? Is it because there's more awareness about what IEPs are? Or is it because the built environment here on Staten Island is so toxic that the birth rates are showing a higher increase of different abnormalities and different developmental disorders that children just need IEPs more here? We don't really know. So 2 of the highest categories here when we talk about IEPs here on Staten Island are developmental persuasive disorders, and that encompasses autism. So about 80% of that encompasses autism spectrum disorder, including Asperger's. And then we also have a category that's about 10% is emotional disturbance, and I want to talk about that category as well. So here's some more startling statistics. Black children are 2 to 3 times more likely to have an emotional disturbance category than their counterparts. And Black boys are 4 to 5 times more likely to have an emotional disturbance category in their IEPs than their counterparts. And those statistics are actually coming out of the Research Alliance for New York City Schools, coming out of NYU. And it's really, really startling. So what does that mean? And I'll let you all kind of like think about that on your own. But while you do that, I'm going to share a personal story about myself as a caregiver. And this is being shared, my eldest daughter, 17, and it's being shared with her permission. So when she was a young girl here on Staten Island, I noticed that she was having a lot of difficulty in school. And there were constant complaints from her teachers, right? Sarah, your daughter is like pushing other students. She's constantly pushing desks. She's very disgruntled in the classroom. And that wasn't like her. It wasn't her temperament to be combative or anything like that. And so I was kind of wondering what was going on. And they were like, we're going to suggest she gets an IEP, emotional disturbance, because like it just makes no sense as to why she's being so angry and so combative and like hurting other kids. I was like, hey, this just really doesn't match up with what I'm seeing at home. And so I began to talk to her a little bit. And of course, she was in kindergarten. So there wasn't really much that I could get from her, but I could sense that she was so frustrated. And so I said, you know what, we're going to talk to our pediatrician. We're going to do a neurological exam, and we're going to really kind of do a deeper dive into what's going on with her developmentally, because I don't think that she's just an angry kid who's going to just go out and hurt people. And there's a puzzle piece that's missing, right? And so we did that, and we ended up getting 2 diagnoses that really helped to change the trajectory of her life and her education. And it was an autism spectrum diagnosis, high functioning Asperger's, but also a sensory processing disorder. So she was pushing those desks in her classroom setting because when she was getting up, she couldn't feel the desk the way that other children felt the desk. She was pushing it really hard to be able to get her body up out of a seated position. And then the desks were kind of going into other children, and she was having difficulty verbalizing what she was saying because, again, you see a lot of speech impairments with autism spectrum disorders. And then when I went back to the teachers and said, here's our diagnosis, this is what we're working with, we need to increase PT/OT, we need to really give her a weighted vest and all these other resources to really make sure that she has what she needs here in the school setting, so that kind of behavior not only doesn't impact other children, but doesn't, impact her. It was shocking. So again, we're thinking about those statistics again, that Black children are automatically labeled with this emotional disturbance category. Where is that coming from? And how does racism play into that type of categorization? And are our Black children on the North Shore and across Staten Island, across New York City, getting IEPs with the category and getting related services that they need to excel? Are they being labeled based on their skin color? Are they being labeled based on implicit biases that our educators have and that are so prevalent within the DOE? So those are questions that we really have to begin to ask ourselves, and they're really uncomfortable questions to ask, right? They're uncomfortable for me to ask as a parent and caregiver. They're uncomfortable for me to advocate around as a parent and a caregiver. But in order for us to really be able to get to that equity that we all talk about, that we all advocate for, we have to get a little comfortable with being uncomfortable, right? So I'm going to talk a little bit about the whole child model. We hear that a lot when we talk about education here on Staten Island, when we talk about education with our children. The whole child model talks a little bit about how the different components of a child, not just education and what their scores look like, what the data shows about their reading and their state exams and their math exams look like, but how are they doing emotionally and socially? How are they doing physically? How are they doing spiritually even? And we see that with COVID-19, that it's all of those areas, the difficulty in all of those areas are exacerbated. And what does that mean when we begin to advocate for changes within the community, within the school system, and how does that all interact with each other? So I want to touch a little bit on CEC. So as I said before, I'm a candidate for the Community Education Council. It's what CEC means. What's really, really interesting about the CEC this year is that this is the first year that a parent or a caregiver can actually vote for a Community Education Council seat. And so the DOE is literally making history. So it's super, super exciting. And if you're not a parent or caregiver of a child in the DOE system, that's okay. You can share the link with everyone you know, tag it on social media, and really let people know that this is a really amazing avenue to begin to advocate for your child, for what it is that you want to see in your school setting, for what it is you want to see system-wide. So I'm running for 2 seats. One is the Staten Island District 31 is all of Staten Island, and also for the Special Education Committee borough-wide. So that means if you have a child, junior high or elementary on Staten Island, or you have any child, any age, whether or not you're in a charter school or District 75 school that has an IEP, in special ed, an individualized education plan, you can also cast your vote. I believe putting in the chat the links for all of the candidates that are running. There's 63 candidates running for 8 seats on Staten Island, which is actually an amazing thing because we want to make sure that we take all of those parents and caregivers. We want to take this momentum and hopefully they'll utilize that in some type of advisory board and really take that momentum to continue to advocate for changes. So that just means that a lot of people are passionate about change. So I'm excited to see those numbers. I'll be putting in the link for all of the candidates, the candidate forums that the DOE was hosting. I'll be putting the link in the chat as well as emailing it. So you can take a look at all the candidate bios as well as the candidate forums and say, hey, yep, that's the candidate for me. And that's who I want to vote for. So it's really important to be a part of that. And there are 2 ways to vote. So I'm going to touch on those briefly. You can actually vote online. We're putting that link in the chat on your My Schools portal. You can also vote on 2 places on Staten Island. I have them here, but I'll make sure to throw them in the email as well as the chat function. And yeah, so that is where we are. I think those are all the statistics that I had, but the overall point that I wanted to make is that we have so much work to do here on Staten Island, especially when we're talking about how racism impacts our students' abilities to learn, our neighbors' abilities to learn, how it impacts caregivers' ability to show up in a space to advocate for their children. And we need to continue to work together to really highlight what those disparities look like and be able to disaggregate data in a way that's truly reflective of everyone's lived experiences. Thank you so much. I'm going to pass it back to Deborah.
Okay, thank you so much. I think that was such a great speech, and it was so, it meant a lot to me because I had worked in special ed for so many years, and you brought up tremendously important points. So I think the thing is that I just wanted to make some comments about what people had said, and the first thing we always want to consider is what is the economic basis for inequality? And I believe that it's a capitalist system that increasingly rewards the rich and disregards working people. As we come out of COVID, yes, there's a lot of money around, but is it going to go to help the people? For myself, I know they're already trying to cut back healthcare for working people in Staten Island, but in the city of New York. In 1970, the corporate tax rate was 49%. In 2020, it was 21%. In 1970, corporate tax revenue as a share of overall federal tax revenue was 20%. In 2019, it was 10%. So, and even during COVID, Black and Latin working people suffered inequitably as compared to the rich. An example of that is in Staten Island, Jeff Bezos, made $90 billion. His company, Amazon, made $90 billion, while in his Staten Island warehouse, mainly Black and Latinx workers slaved under intolerable conditions. The COVID epidemic increased inequality in education. Students, one of the things that Sarah Bloss brought out was about emotional well-being, and students who are mandated for counseling in schools should receive their therapy sessions. Principals should not be interrupting therapy schedules for other school duties. Additional funds should be allocated for personnel dedicated to duties in the schoolyard or cafeteria or crisis interventions. And school discipline systems shouldn't be modeled on the racist criminal justice system, but should use counselors and appropriate educational placement to address ongoing student behavioral challenges. Future solutions to inequality in education. Some poorly performing schools change the emphasis of their curriculum from teaching skills to teaching to the tasks that the administrators think will be on the test, so that the school's profile will improve. But students should be tested at the beginning of the year to determine what skills they have acquired, and a plan should be made to enable them to learn the necessary skills to achieve their next highest level. Teacher assessment should not be a comparison between a student and a norm-referenced average performance on a specific grade level, but an assessment of whether a student has improved and reached his personal yearly goals. Students should be assessed, even for specialized high schools or programs, in multiple ways. Eligibility should be determined not just on one standardized test on one day, but through portfolios, oral presentations, and research papers. On the North Shore, the share of students enrolling in post-secondary education has declined. And we should increase the availability of AP classes in all high schools so that most students are exposed to a post-secondary curriculum. Skilled trades offer careers and demand sophisticated skills: literacy, math, computer science, problem solving. But classes teaching vocational skills are shrinking, not expanding. This is because vocational classrooms are more expensive, with mandated smaller class sizes and costly materials and equipment. As Bijan said, the North Shore needs more frequent bus routing so that parents and high school students' commuting times can be reduced and students' attendance can increase. Class size on the North Shore should be limited to 20 students in regular education classrooms. Diversity should be increased in North Shore schools. One strength of the North Shore of Staten Island is that is one of only 10 community districts of 59 New York City community districts in which no racial or ethnic group represents more than 40% of the population. As a result, it would be relatively easy geographically in the North Shore to organize schools to reflect this racial, economic, and ethnic diversity. In the 1970s, Staten Island built new schools on the North Shore across from housing that had predominantly African-American and Latinx residents: PS 14, PS 18, PS 37, PS 57, which created severely segregated schools. PTA funds should be equalized for all schools. ESL opportunities for students should be in class or small group based on the needs of individual students. ESL opportunities should be provided for parents. How can we change school culture? We should encourage teachers who are anti-racist to speak out and join with others in the school community. Teachers and students and parents must unite and depend on each other's strength in order to obtain school resources. Teachers and parents should learn to be advocates for each other. Teacher diversity on the North Shore must be increased by preferential hiring of Black and Latinx teachers and teachers who live on the North Shore. What are the goals of education? We want our students to overcome the obstacles that are in their way and reach their potential. We want graduates to be able to obtain a meaningful job that allows them to live in a comfortable home and gives them access to quality healthcare and education. We want all students to be literate so they can understand the society and organize to fight to change it. So thank you everybody for your participation today. And you all brought valuable information and ways that we can connect to each other. And now we will open up to the chat and questions that people have. Thank you. All right. Now what? Go back to Zoom. Okay. Are you managing the chat?
Yep.
Okay. Okay.
We'll ask if there's any questions.
Are there a lot of people put stuff in the chat?
There was a question in the chat. Can I read it for you, Debbie?
Yeah, sure.
Okay, Barbara Kent asked, could PASI and maybe other community groups approach banks on Staten Island to urge them to support these efforts and provide resources in return for state and federal CRA credit? Barbara, if you want to unmute, you could also, if you can expand on that.
It's just that banks have to have at least an acceptable rating of CRA credit. They give money. That's the easiest thing to do, as opposed to being creative. But money is not a terrible thing. It seems to me that some of these organizations that we've been listening to have identified real needs. And if we went, whether it's PASI or whether it's PASI and so, I mean, the two banks on Staten Island that I would start with are Capital One, because I know the CRA compliance officer there, and New York Community Bank, because Richmond County Savings Bank is a big part of New York Community Bank. But we'd have to have a meeting just if we want to do this, try to contact these people. And, but obviously I would want to, at least at the pre-meeting, to be able to put together with the speakers that we've had today, to put together our talking points. We won't get 2 hours to make a whole presentation. So we would need to streamline it and also just see, I may be wrong, maybe money and staff would not be of any help. And that would end the discussion right then. So that's my question.
So does anybody, Deborah, you're on mute.
Okay, does anyone want to respond to that point?
I can a little bit. I think that's a great idea. I always think in terms of hospitals. Hospitals have nonprofit status, but they are required to invest in the community through a community benefit fund. But I didn't really think about it in terms of CRAs and banks. Mm-hmm. I think it's a great idea. I know a bunch of community partners were looking at ways to create like a community funding hub on Staten Island to get those types of dollars and pool them for specific projects that the community identifies. So I think it's a very interesting approach, and I'm happy to help think it through if anybody wants to move it forward.
Yeah, I mean, Sally and Eileen, you really have to be the ones to say, like, could we set up a meeting? I mean, does it have to be a Zoom? Could we find an outdoor place that we could all actually get together face to face and put this together?
Well, our backyard is always open. We have a lot of seats. But I wanted to say one thing. You said, will the money help? And I've been involved since the 90s. I got involved with the CFE, the Committee for Fiscal Equity, which won a New York State saying that school size should be equalized. I had an interesting experience in 2001. I was part of a statewide mandate to write curriculum funded from Hofstra University, from the NSA for science, math, and technology. I was a technology teacher. Everybody, 30 people came to my classroom one summer. We moved from classroom to classroom all around the state each summer to write this stuff. When they came to my classroom in New York City, they looked at the number of seats and they said, how do you teach 2 classes here at once? And this was suburban schools, other city schools. Buffalo guy had the same problem I did. And the woman from, I forget what the other city was, Rochester too. Class sizes was big. They could not believe I had 34 students at once in a class. So money would help. New York City, we've never done it. So money by changing class size, that is the biggest difference between private schools and public schools.
Yeah.
So that would help. That was my.
Okay, but I know an awful lot about CRA. I know probably 0 about education. So, or maybe 1%. I'll give myself that much. So I'm just putting forth the idea. And, you know, if it's something we want to follow up, then maybe we could set up a time to come to your backyard. I would like wine, and I would like caviar, and I would like ice cream.
Those require money.
John Lawrence also has his hand up. John, would you please unmute? I think it's your hand. You have a question. Hi,
yes. Hi, do you guys hear me?
Yes.
Okay. Yes. All the speakers basically noted that these problems are rooted in the gross inequality of our system, and Debbie just noted that that's baked into our system. That is our system. And I was wondering, do your organizations advocate specific proposals for redistributing wealth and power?
Does anybody want to answer that?
One thing that I'll say is that we've been advocating for a lot of different ways that have specific supports for low-income families. We more and more are rooting it in this specific aspect of systemic discrimination that's happened over time. It's way before the murder of George Floyd have we been trying to address these inequalities, but people, for some reason in 2020, have woken up to it. So I think that it is something that we do in terms of specific economic proposals, but there's ways that I think are a little bit more implicit too, that by addressing things like the early intervention program, which there are gross racial and ethnic inequalities in terms of access to different programs, in part rooted in the economic inequalities. I think a lot of our advocacy is focusing on that aspect too, which is not so much the economic component, but is the combination of educational opportunities and economic components. So we try to do our best. There's a lot of ground that we need to cover, in my opinion.
Ask a question, Neil. I want to ask Debbie or the panel.
Go ahead, Neil.
I want to ask the panel or Debbie, you know, the 2 things that were proposed about 10 years ago was cultural responsive education, which is CRE. It was proposed by the Coalition of Educational Justice, and it was presented to the DOE. And I think the funding came through for the cultural responsive education. Would you be aware of that? And also, what we want to talk about are community schools. Community schools are very successful all over the city. And why is that now so limited in its vision that community school, you know, not only help the community, but they help the individual students? Anyone want to answer that?
Neil, are you asking why there are not more community schools?
Yes. And this has been discussed on many, on different levels about community. I mean, not only cultural responsive education, but community schools. For the last 10 years, many of the other boroughs have implemented over 40% of their schools to community schools. Staten Island is so reluctant on the North Shore, or it's definitely not on the South Shore. what's the drawback that and maybe because she's going for that office, that would be something that she would want to talk about, Sarah, because we really want to cultural responsive curriculum, and if that's a way of eliminating some of these biases and some of this history that's been distorted, would be to our advantage if we had some of this cultural responsive education, and they come directly out of community schools, which have known to be very successful on Staten Island. So the question is that something she would be willing to discuss, or would anyone like maybe Kelly? We've always had that conversation about cultural responsive education.
Are you talking about schools where they provide like healthcare in the school and they provide
No, education around education around different cultures, whether it be Asian, whether it be Black, and these cultural responsive education would include the history of certain different cultures, not just the American history. And many in our public schools don't have a curriculum designed for cultural responsive education. And we do have that program being implemented by DOE, but it's not being discussed on Staten Island. We're just curious as to why we never have discussions around cultural responsive education.
Well, I think,
Yeah, no, I could just speak just because we just had Dr. Marian Wilson's the new superintendent, acting superintendent, and she did talk about culturally responsive pedagogy in her plan. And so I think that there is a movement, and I know that like CSI and their teacher preparation program, it's a huge piece of it. So this is where things are going. Maybe I think it's taking too long on Staten Island, which is often the case. And then the community school piece, I think Debbie, you were hitting it. Like community schools, it's a designation, and I feel like often they have a school-based health center or some anchor CBO institute to coordinate the services of nonprofits in that catchment area. I love community schools. Like I'm on the community school board at Curtis because I feel like it is the realization of what SIPCW is about, like those partnerships and providing these wraparound services, to Sarah's point of like supporting the whole child, the whole school, the whole community. Like you have to shift all of that. I think it would be great to have more community school designation because it's more dollars that come in, there are grants associated with it, there's more programming, it opens up services to the family, so it's not just the students in the school. So I don't want to speak for Sarah, but I think that would be something interesting for
I think to have that type of setup, because when I was a chapter leader in my school, I did bring that up. And the administration there didn't feel confident that they had some school-based programs in there already, like UAU, and they felt that they didn't feel confident that they could manage all these other services in their school, and that was part of it. Now, I think the other part of it, what Neil was talking about, was I think it is important that we diversify our staff, and that there be more Black and Latin teachers on Staten Island. And also people who live on the North Shore, because I think that there's a certain sensibility of people, of the staff who work on Staten Island, because I worked in a school and, to be honest, some of the teachers that transferred from other places, they felt that this was their opening to Staten Island, and they weren't really that committed to the Black and Latin students in my school that were predominantly, that made up the student body. So I think we need staff that is really, open to that type of curriculum too, and understand the importance of that type of curriculum. And that's also why I said that I think it's important to have staff that are committed to be anti-racist and to encourage the staff there to change the culture in the school, to be proactive in terms of the students and understand their needs. And that's,
Debbie, I just wanted to let you know Sarah has her hand up.
Oh, I'm sorry. Are you managing the chat or should I? I don't know.
But just Sarah, if you'll unmute yourself.
Sure, yeah, I'm here. Thank you so much, both Deborah and Sally. Neil, that was an excellent question.
Yeah.
The very uncomfortable answer is because racism is so ingrained in the Department of Education and within Staten Island on multiple layers. So that's the very hard, uncomfortable answer. We see that now as multiple people are starting to, and multiple institutions are starting to celebrate Juneteenth, people are getting really uncomfortable about that. They're like, hey, you're taking away Columbus Day. What are you doing? Even elected officials are issuing statements about the Department of Education doing something that is so meaningful and is the first step into really understanding Black history here, not only on Staten Island, but nationwide. People are very, very upset about it. So before we can get into why schools aren't doing culturally appropriate programming, we have to take a step back and make sure that not only our educators and our elected officials are getting diversity and equity and inclusion training, but so are the policymakers within the DOE to really have an in-depth understanding about why this is so important and how it affects the children's emotional development, how microaggressions affects parents, how they affect children in general, and how that really equates to a child being able to show up in their full self and being able to meet their potential in an educational setting.
Thank you. That was awesome.
I don't know if, I just wanted to note that Bijan put something in the chat about responding to John Lawrence's question. Do you want to say something, Bijan?
I think John's question is really important. I think everyone needs to be doing more to address what he was asking for. So I put in a link to an article that I wrote with a colleague, Jack Mullen, that I think it touches on this, but it doesn't fully address your question, John. So I just wanted to share. It also has more data on income inequality in New York City, which I think is what you're trying to highlight.
Can you make a copy of that link?
Okay, Debbie, back to you. I just wanted to.
Oh, that's fine. It's just, I'm happy for you to step in. It's great. Does anybody have any other questions? Eileen?
Yes, can you hear me now, or am I still?
Your mic is really, that has a lot of static on it.
Then I don't know. Well, I just wanted to quickly say, in response to Barbara Kent's suggestion about providing a space for any kind of discussion on the issues, we would be more than willing to do that. Yeah.
I just want to say something about what Sarah said, because I kind of got hired on Staten Island by accident because I didn't know anybody. And I think that's something that really needs to be monitored in terms of, hiring practices on Staten Island, because whomever has control seems to hire their friends and relatives rather than really changing the makeup of the staff. And I think that's, an important thing to look at in terms of diversity of staff.
So Eileen and Sally, maybe we can pick a time that can meet and see, if other people can join.
Okay, so I just wanted, Debbie, are you planning on closing out now? Because we can, if the people that are going to stay on for the little meeting for Peace Action of Staten Island, they could stay on because Casey has joined this.
Okay. Does anybody else? Well, first of all, I wanted to thank the presenters. Bijan, thank you so much. I know your time is very valuable, and you really contributed hard data in terms of differentiating, the North Shore from other areas in Staten Island. And I think we have to continue to fight together and support each other. And there's a lot of important issues on the North Shore. And as residents, as parents, as grandparents, we have to be concerned. We want available housing, but we don't want gentrification. So we have to think about all these issues. And you really made us aware of the whole well-being of the children and families on Staten Island and on the North Shore of Staten Island. And I want to thank you for that. It was very important. And Adrienne and Kelly also thank you. And Sarah, your contribution was immense. So I want to thank everybody and for being willing to participate, an opportunity to put their ideas and their questions on the in the chat and or to raise their hands. And are there any other questions that people feel are very important? If not, I hope that we can get together to discuss these important issues.
I had one other question. Is it okay? So in the 90s, there was a common argument saying that the cure for poverty is for poor people to get married and stay married. And I was wondering, that Bijan showed an interesting slide at the start where there was an interaction between gender, race, and marital status predicting child poverty. And I was wondering if is this still a common argument? And if so, how do you respond to it?
Can you repeat the first part of the argument?
Sure. In the 90s, a common conservative answer for poverty was saying that poor people should get married and stay married. And I was wondering, is that still an argument that you hear? And if so, how do you respond to that?
Yes, I think that's still an argument that we hear, but the reason the data that I shared, I just want to be clear, is not projections, but they're estimates of the reality currently happening. And the argument that I would say, this is not because of first of all, it's the racial differences and the gender-based differences that are important to identify, because for white women, the poverty rate for single white women has households, the poverty rate is much lower. So it's really the combination of the racial discrimination and gender discrimination that you see, wage discrimination for Latina and Black mothers who, if they are the only income earner in a family, that's going to have more detrimental effects on the children's poverty rate. So yes, that's an unfortunate argument that's still being used. But when we think about this, not so much in terms of the marital status, but the gender, because this happens for single men, they don't have as high poverty rates or their children don't have as high poverty rates. So it's really this combination of racial and gender discrimination in wages that is what's detrimental to well-being.
Okay, so
Thank you.
I want to thank everybody again, and especially you, Bijan, and I hope we can work together in the future and stay in touch. Everybody stay in touch. So thank you again, and I know you gave a lot of thanks to your people who collaborated with you, and that was great. Okay, thanks. Thank you so much. I really appreciate your working with me. So, and thank everybody else for participating and listening, and I guess it's time to